My name is Victoria Landry, and I am a stroke clinical coordinator with the Institute of Clinical Orthopedics and Neurosciences here at Desert Regional Medical Center. What is a stroke? How do we define a stroke? A stroke is basically a brain attack. A stroke needs to be taken as seriously as if someone was having a heart attack. What happens in a stroke is that blood vessels that carry oxygen to the brain are blocked, or the brain has a bleed. There's basically two types of strokes. The most common type of stroke is an ischemic stroke, where there's either a clot in the blood vessel or a buildup of plaque in the blood vessel. And then there's also hemorrhagic strokes, which involve bleeding into the brain. For every minute that a stroke is left untreated, the brain loses 1.9 million neurons, and in 1 hour can lose up to 7 miles of synapses. Very quickly, the brain ages years if a stroke is left untreated. The most important risk factor for stroke is high blood pressure. If you have high blood pressure, please take your medications as directed by your healthcare provider. And also make sure that you check your blood pressure regularly, even if you're feeling well. The second most important risk factor for stroke is smoking. If you smoke, stop. What happens in smoking is that tobacco and nicotine damage the blood vessels of all of the areas of the body, including the brain. Diabetes also damages the blood vessels. If you have diabetes, it's very important to make sure that your blood sugars are kept within a range that's specified by your healthcare provider. Another risk factor for stroke is being overweight. It's very important that everybody is as physically active as they can be and follow a diet that's rich in fruits and vegetables, lean proteins, and please reduce your intake of processed food. Having high cholesterol is also a risk factor for stroke. What happens with high cholesterol is you get the buildup of a fatty plaque in the blood vessels. This can happen anywhere in the body, including the brain. Illegal drug use and excessive drinking are also two modifiable risk factors. It's something that we probably all don't think about enough. The best way to think about recognizing signs and symptoms of stroke is to use the acronym FAST. F stands for face. If you notice that someone around you all of a sudden has an uneven smile or a droop to the side of their face, that may indicate that they're having a stroke. A stands for arm. If you notice that someone is having difficulty moving their arm, or if you ask them to raise their arm, if you notice that one arm is drifting or is weaker than the other, that's also an important indicator that someone may be having a stroke. S stands for speech. If someone's speech suddenly becomes garbled, unintelligible, or they're unable to speak, this is another important indicator of stroke. And finally, T stands for time. Time is of the essence. Time is brain when it comes to a stroke. Treatments for stroke are time dependent. It's important that you don't wait to see if symptoms resolve. You need to call emergency services right away and make sure that the person gets medical help. Here at Desert Regional, we are an accredited, advanced primary stroke center. We are able to care for all of your stroke needs.